live sign to appear. Yes.
Yes. I'm putting it on the record as well.
Good evening and a warm welcome to Expert Talk series. My name is Akil Rashid, and I'm the Research and Knowledge Hub Chief at Jammu Kashmir Policy Institute. I will start today's session and introduce the speaker. Jammu and Kashmir Policy Institute has initiated Expert Talk series to engage experts, change makers, pioneers from various walks of life to understand the dynamic context of implementing the United Nations Sustainable Development Goals on our agenda. The vision and intention of the Expert Talk series to source inputs and recommendations from experts in various fields pertaining to different sustainable development goals through one-on-one dialogues. The hour-long interactive session will consist of one-to-one dialogue between the moderator and the expert to dig deeper into various topics and probe their various dimensions with a dedicated Q&A. The entire session is being broadcasted live on the official Facebook page of Jkpi. Tonight, we are delighted to be joined by Dr. Nisha Khanna, who is a mental health care professional from past 19 plus years. She is one of the leading professionals in the field of mental health. She assists individuals and couples from every walk of life. She has offered assistance to professional and personal related needs of an individual, couples, and families. She has provided consultation to more than 30,000 plus people on one-to-one basis and has spent hours to listen, understand, and solve their concerns. She dealt with clients having emotional, mental, and physical and adjustment issues in their love, friendship, live-in, premarital, post-marital, post-marriage, family, professional life. She deals with parent-child relationship, depression, insomnia, anxiety, and all other kinds of moods, emotions, temperament, personality, and behavior issues. Dr. Nisha will discuss the topic COVID-19 and mental health. The discussion is focused on SD3, Sustainable Development Goal 3, good health and well-being, and the impact of COVID-19. On behalf of the entire team of Jkpi, I welcome Dr. Nisha. Thank you very much for taking the time to be with us. Now, I would like to pass on the mentor to Ms. Sohani. She will facilitate the session. Thank you.
Thank you so much, Akil. Welcome to this humble platform. Dr. Nisha, thank you so much for taking the time to be with us today. We want to open with a few reflections that you may have based on your experience over the past 1.5 year of how you have possibly seen the COVID crisis evolve, and what has that brought to light when it comes to the mental health situation across the country. And why do you think that this discussion warrants more attention even at the policy level, at the institutional level? So we'd like you to first give us a brief idea about it before we move into more specific questions. Thank you.
I would say in last 1.5 years as a mental health professional, I have dealt with the cases of anxiety, panic attacks, depression, stress, adjustment issues, maybe isolation, especially at the time of when the people are into the COVID times, OCD or like hygiene related issues like lack of social interaction with the public, how impacting. Like sometimes I remember in the month of April, the clients called me up that I want to come out of the house. Just doctor, I don't want to take online consultation. I remember when I issued the pass to the patients and okay, you can come and meet me for an hour of session and something like that. So just like the lots of people's fears and insecurities got highlighted in this particular period. Like for example, the couples who were not inside the home with longer time with each other, because as we all know from last 1.5 years, the work from home culture is too much in highlighted. And in this process of that, we are interconstrained in the premises of our houses, our spaces, where lots of family people are there. And sometimes you are not comfortable sharing the space with them. So that sort of issues you can say, you are not used to be into 24/7 in the house, be with the people, because initial days, spending time with family is okay. But after a time, it's not an okay. And then in this limited spaces, tough time, what to do? Like you watch movies, you watch, do exercise. After a time, you get all bored. You do cooking. If you know that first phase of lockdown, the people do all cooking. And the second phase, it was more worse for them. And I think so. If you'll ask me that, as compared to the first phase and the second phase, I got a lot of clients. I was working. Even physically, the patients were visiting, and they want to come. Like from April onwards, when the second phase or wave came. So I would just say that like suicidal things, thoughts were there, hurting self, hurting others, thoughts were there, and people will come up and they started speaking it out. Like they need help, they don't like this, they don't do this. It's like now when the journey, the people were not able to go out, they started going inside. And when you sit silent, your mind starts speaking it out. You start listening to your heart, basically, and you start in what is your comfort zone. Like I remember the housewives, when they were unable to manage their work, like infidelity came up during this timings, when the couples were saying that, okay, before he was not there in front of me, I was going for a work, or she was not there in front of me, or he was not there in front of me. Now fiddling the phone in front of me, it's irritating me more, because 24 into 7 I'm finding that person in front of me. So getting those things, like the stress and anxiety incidents are more into highlighted. The frustration level has come up very much high, I would say. As a professional also, our life became too hectic, and the people started finding it out. Even you have too much of money, you can't able to control on certain factors. Mood swings were there, too much highlighted. I would say bipolar factors were there, borderline cases were there. They were there earlier, but not that highlighted. People were approaching to mental health professionals a lot. Maybe in the last 1 year, I think so, I have done in 70-80 webinars about mental health, where this sort of mental health approach in the whole public was not there. The colleges were approaching, like the institution wide, like you were talking about mental health, and each person is concerned about mental health, and they were approaching. There are certain people who were hiding from their family members, and now they are talking to their family, I need a help. Like some people were lost their loved ones. Those were the concerns. I'm unable to move on. Some people from last 4-5 years unable to move on from their breakup, and now how to move ahead. They are having the realization, oh, I was wasting my time, I have lost my 4-5 years, now what to do, how to get over, overcome this particular timing. Maybe the lockdown make them realize that there is a lesser social interaction, and then they realize, okay, what I'm doing with their my life, whether it is a male or a female. So there are certain couples where they had not a good relationship, they spend time together, and then they realize, okay, I'm not doing anything in my career in last 20 years. One partner may realize that, okay, my partner is not good enough for me as a life partner, maybe good as a person. So incompatibility issues were being highlighted more. um, People realized that the even people were more inclined towards their health concerns. Like they were not thinking about their work more. Like even the mental health professional like us were talking. I took a break, I think so, in my career. From last 1.5 year, I'm taking breaks on Sundays. So I can say, you can imagine that you started realizing there is a pressure is coming. So like putting up in the boundaries, teaching them all those things, that you have to say no for the sake of self. I don't know how many people I annoyed in last 1.5 year as a personal or professional friend. Tell them that, okay, I can't take more. So I just say that in this time period, and I will say as a professional, when I know about what is the importance of mental health, and people started giving importance. As a professional front, I will just say it's been highlighted, and it gave people realization your health is important. You are important. Your mental health is important. Your financial health is important, because lockdown also make them realize your jobs are not stable. Like you can lose your job, even you are doing your job from last 5 years, 10 years, because company was having financial losses. So someone was facing the financial problems, how it impact the psyche on the mental health of the professional, family. The It's like the losses the people are facing, how it impacts in their relationships. Which is more important for you? Relationship is important, your personal health is important. And when especially the quarantine period, when people were spending time alone, that gave them more insight about themselves, give them more like getting into their insecurities, because people are more used to be with people, either introvert or extrovert. Extrovert felt more problems as compared to introvert. But it would say that the lives for each and every person, because we have a need of gregariousness, it was very difficult for people. And it is okay to be okay. That got normalized. I think so. We were doing this like before this your session. I was sitting with someone, and he was saying from last 1 week, doctor, I'm not okay. So I was saying it's okay to be okay, not okay. You are going through a bad time from last 33 years. There's a lots of ups and downs. It's okay. You are relaxing. This time is different and difficult. It's okay to be like the way you are. You are awesome. You have to encourage yourself. This is like these sort of problems people come up, like they are feeling low without any reason. So it's okay to be like that. That's basically thing. They feel that there is no one who understands them, who supports them, who make them realize they are important, they are good enough. Because sometimes it's very difficult to put yourself on the motivation level on the same pace.
Thank you so much, Dr. Nisha. This COVID situation also brings up two other aspects which are very important for discussion, which is that, as you rightly pointed out, there are so many dimensions to the stress levels hitting the peak that we saw during this time. I mean, so there is an element of preparedness, of course. How prepared were we as a country to take on the kind of stress-based challenges that would come up? Are there enough mental health professionals? Are there enough institutionalized support systems that could perhaps take on this kind of a shadow pandemic, as they say? So that would be my another question. And along with that, I'd also like you to reflect on the fact that, do you think that this pandemic actually brought helped people to break the taboo around mental health? Because earlier there would be stress, but a lot of stress was normalized, and it became a culture of, oh, when you're having stress, it means that you're working hard enough, or you're doing what you should be doing. So in daily life, people wouldn't factor in stress as something that necessarily is something you talk about as even the foundation for mental health issues, leave alone mental health used to be a taboo. So two questions, ma'am. The first one being, how prepared were we as a country at the policy level, at the institutionalized level? How prepared were we to tackle this? And second is, obviously, did this situation help to break out of that taboo we have about talking about mental health, and destigmatizing it, while also factoring in this renewed idea that stress is not normal, like this level of stress is not normal?
I would just say that one thing everyone knows, that number of mental health professional is not good enough. And I'm telling you, in pandemic times, how much mental health professionals were working? That was also a big question. Who were working? They were working. Like you can imagine, I'm starting my day at, I think so, 11:30 or 12 onwards, and I continuously working till I started your session. You can imagine from last day, I think so, I have to put my patient on a hold to have my lunch. And they, okay, go doctor, you have lunch, and then we can start the session. So I'll just say that as a mental health professional, they are not good in numbers. Second thing, that it's not only about, I would just say, mental health stigmatization is being broken as a taboo, because lots of people will come up and speak about their concerns. And it became normalized when we says it's okay not to be okay. We are style, can give you an example. From last 10 days back, I got some boy, 16 17 years old. Parents brought it. His sleep is getting disturbed. And when I talked to the guy of 16 years old, he told me that in this year's, I think so, 2 3 or 4 incidents he discussed and shared with me, where his father hit him with sandals, chappals, because he doesn't like to go out. His father told me he traveled 17 countries in last 17 years of age or 16 years of age. He doesn't go and buy for shopping. He's an introvert guy. They don't talk about emotions. They don't talk about feelings. And I remember that after 2 sessions, I called his dad and told him that I want to talk to you about, this is not normal what he is going through. And he's a normal child. A person who is an introvert doesn't like to go outside and doesn't like to go and interact with a person. It's okay to be okay, but you can't hit the child with chappals or sandals for the smallest thing. So you can imagine that mental health issues need to be addressed. You tell people, don't say lie. I say is that if you don't like cooking, tell you don't like cooking, but don't say a lie for that thing. Just be comfortable. This is I learned, like this is what I can do, this I can't do. And this is when says the mental health, the no word to be common. So when you says that mental health professionals are not good trained also, I will just highlight this, they are not trained well also. They don't know that putting a boundary is normal, saying no is normal. I will say as a professional, when I say no to people, I say I'm a mental health professional. Like I can't take care of my boundaries. How I can teach other people? I should be ideal to them. They should know this thing you can talk right now, this thing you can't do right now. So I just say that as a mental health professional, it's good people started thinking about mental health, talking about their feelings, and it's nothing good and bad. It's nothing right and wrong. You like it, you don't like it. There is nothing good and bad feelings. There is nothing good and bad thought. It's like two people are different individuals. Just they can't be together. Even as a couple, even as a family member, they need to accept each other the way they are. Just be open, speak it about what you like, what you can do, what you can't do. The more you open up, more you speak the truth, the relationship, and you will be more at comfort zone. And I think so this is the time when people started talking about their comfort zone. I remember when the housewives was telling me that I get tired the whole day. I said, speak it out, communicate what you feel. It's very important. What you feel, communicate. What is okay for you, communicate. Listen to yourself, listen to others. And this is the pandemic time, I think so, make us realize the importance of us as a human. You start thinking about your comfort zone. If you are at comfort, then you can make others at comfort. I remember when you are talking about that, and I'm as a mental health professional, and I'm literally saying it that as a mental health professional from my juniors, they said it to me, how we can come to the clinic? I can't put our life into danger. If I start thinking as a mental health professional that I'm putting my life into danger, I'm working like morning till evening like a machine. I'm literally saying it that if the people in my surroundings, people are not able to see that, then it's a question that maybe what I'm doing. So it's like the people are become more sensitive, and if they understand what the person is going through. Last night I was dealing with one couple case, and I was telling the wife that she says I like slow life. I said it's okay. And their husband is the person who get up in the morning. Their wife likes to get up late in the morning. They were not getting me time together, couple time together. He says I take breakfast alone. Maybe we don't spend time as a couple together, because when I sit with him, he just crib, complain. She just crib and complain. So this is just what talking about that when you are into a tough time, people have crib and complain. Don't think about, I will just want to highlight through this mental health professional thing. Then talk to your friends. Sometimes each person has their own package that full with the problems. You can't go and talk to your partner always. You can't talk to your family member always. Go talk to your friends who are there to you as a support system. My friends are not there, go to the mental health professionals. And this pandemic time, break that taboo. And I remember lots of my employees, I told them that I don't have a time, go to my juniors, talk to my juniors, share your problems, what you are facing the problem with your wife, what you want to do, how you want to handle. If I don't have a time, you can go to the juniors and talk to them. And I think so it should come up from each individual that it's nothing wrong. Like the way you have a fever, you go to a doctor. Like the dentist, you have a trouble in your teeth, you go to a dentist. Same way, when you have mental health problem, you are stressed, you are unable to handle your issues alone by your own, go and talk to a professional. If you don't have a support system, you don't have friends to understand you, you go and talk to the people who understand you, who give you empathy, who see you are in trouble, you are in need of art, I'm there for you. And whatever way you are awesome. It's nothing wrong the way you are. But maybe two people, sometimes even the family member, it's very difficult for an extrovert family to accept an introvert. Each person's. And I would say in our surroundings, we find such people very common. Like giving you the example of that 16, 17 years old child. He's an introvert child. He loves to do for a boxing. He says, my father mock in front of everyone. I'm a stupid, I'm a dumb, I'm a duffer. This is, I'm talking about 16, 17 years old person. So it's not, this family doesn't have any problem of money or a monetary problem, but this family doesn't considerate other person's feelings. Just push other on feelings on other person. Don't giving him the space. If they are giving him space, talking him that you can't do anything in life. So when you keep saying all these things to a person, that you are a duffer, you are a dumb, you are an idiot, you can't do anything in life, you can imagine what we are creating. We are in a country in India where parents are very usual say negative comments to the kids. It's very usual.
Yes, ma'am. Definitely reminds many of us of a number of things we have heard at our level. Ma'am, you there? Your video is frozen for some reason. Are you able to hear us? Hello? Yes, Dr. Nisha, I think you're back. Yes, so that's what I was saying, that indeed, I mean, not having enough empathy, and not to mention that conscious parenting is something that is not common in India, or rather even in Asian societies. There's a lot of insensitivity which is also normalized within relationships and the family structures. A lot of family trauma gets passed on. I think Dr. Nisha dropped out. We'll just wait for, yes, she's back.
Sorry, there's a connectivity issue.
No, we understand completely. So, Dr. Nisha, now our questions will move into a more specific direction. We will be discussing more about the kind of problems that are unique to not just people who are struggling to handle the pandemic and the changes that it brought in, but we are also going to be talking about a disturbed conflict zone like Jammu and Kashmir, and based on your experience, how you think situation can be better, or what kind of support is required. For this segment of the dialogue, I would love to invite my co-facilitator for the evening and my colleague, Ms. Jigyasa Gulati, who's going to take on the discussion from here. Jigyasa, over to you.
Yeah, thank you so much, Sohini. And as I was listening to the entire discussion, like there are certain specific issue that has come up. For example, as ma'am just mentioned about the mental health considerations, how it has actually come up in the mainstream, which was not so much discussed before the pandemic as such. But at the same time, we see that the stigma around mental health is still there. So, ma'am, what are your thoughts on the same? Like, what would you suggest, and what you have observed in this past 1.5 years about the entire discussion around mental health? Are people willing to go and, for example, come to you, or what are your observations basically, ma'am?
I would say people are talking more about mental health, at least acknowledging they have issues, they have concerns. I don't know, people started, I remember that while working with me, lots of employees comes up and started accepting, okay, I have problem at home, I have problem in my personal life, I have problem in my married life, I have problem back down the home. I'm giving you an example. Right now, one girl is working with me in 24 into 7. She's living with me. And the day she came to me and she said it to me, I don't know cooking. Later, she told me, I told you a lie because my husband doesn't like my cooking. So it's not about lie. So I have not put a responsibility of cooking, but I want that if any time you need it, I need, like she has to cook once in a month or 2 days in a month when my cook is not there, at least she can cook. But that willingness is also not there. That willingness, that's what I'm saying to you. But maybe that willingness is not there. Maybe the husband is a cook or a chef and he criticized her a lot. So I see her every day when she do the cleaning of my house. She's totally sweating. And then I asked her today morning, "Tumne kabhi safai ki hai ghar ka?" She said no. Just by seeing her sweating, I was able to judge that इस लड़की ने 3 कमरों का सफाई भी कभी घर में नहीं किया है. She's like a doll. You can talk with her, deal with her. If you will say that if I am outside, I have no responsibility of my patients, I may love to interact with her. But I am whole day busy. I want the things to be khana de do ya kuch kar do. She's unable to do. And I'm telling you, I'm sometimes scolding her badly that why I'm not doing this. The whole day I'm working, but you're sitting idle. So just giving an example, this people started realizing they have problems. They are coming up. I remember I dealt with one person who came to me for an interview regarding the post of my PA. Why I'm giving you examples so you can correlate with that. This girl was preparing for UPSC. And she told that I would like to interact with you. I maybe would like to join you as an assistant. So I said, okay. I interacted with the girl and she told me, how many calls in a day comes? I said, sometimes 2 calls, 5 calls, sometimes 20 calls. I can't tell you how many calls. So I had a doubt. She has some hallucinations or delusions. Asked her. She said, I have a problem with the ring of the phone. So I was thinking from the perspective that she has a problem in the ringing because it's a sign of schizophrenia that people have hallucinations. They listen to ringing of the phone. And I'm telling you, I told one of my intern, talk to her. And we came up, her parents were split. Father got second marriage. And I'm telling you, she shared all the details. We did his personality testing. His report came out to be very bad. Even he was a UPSC aspirant, but she was lacking on all the parameters, which I was very like, and we got to know she was noting her timing at how much time she will spend in a bathroom. You can imagine UPSC students studying 22 hours in a day or 16 to 20 hours in a day she was studying. And if she was going to washroom, she was noting down the timing. She has nothing to do else. And when I saw that girl, she was totally drained. She was totally drained with exhausted, and she has a like how much money you will give. I remember I told her you have to iron your clothes every day when you have to come to clinic. She felt very bad. How come a doctor said it to me? I said, patients will come, you have to iron your clothes. And she started crying for this. This was not a reason of crying. The reason was something else. I was able to judge that. But this is giving you a smaller interaction in my personal circle. And you can imagine in a professional circle, how much examples I can give it to you. So people are coming up. They are opening up. They are expressing that they are overwhelmed. Yes, they don't want to take a medication. They don't want to take a professional help. That is different. Lots of people, I am telling you, 20 years, 10 years ago, I met them and they immediately called me up. Can I talk to you, Nisha? I want to talk to you. And you know, that talk was nothing about, I know they have some problems in their personal life. So it's very normal. It's not nothing wrong, I would say. People are coming up acknowledging they have problems. And that's very nice. And I'm not finding it bad as a mental health professional. People started acknowledging. Even I tell people right now, I need someone who can listen to me and follow my instructions as a boss, not give me guidance because I have workload over my head. Yeah. So hope you can correlate what the question you was asking me, that people are coming up.
Definitely, Emma, and I guess it's the best way to understand the situation when you are hearing the real life stories. And when you are actually sharing all those cases, I guess the best way to understand how people are actually suffering. So thank you so much, ma'am, for sharing those stories. And definitely it's a good point that acknowledgement and realization is coming up. At the same time, people are not so much willing to take medication because I guess still they have some reluctance. So ma'am, because as a policymaker, if I just put myself in a shoes of a policymaker and I see the entire situation, it seems very grim to me. Mental health is something that we should be incorporating in designing any interventions. So ma'am, what would you suggest to a policymaker? How can that person incorporate the needs of people whenever we're designing any policy?
I would say like CSR being imposed on the corporate companies. Why can't we impose this thing also as a mental health professional? Another on the policy making, like in the schools, it's a compulsion to have a counselor. And I think so. Every school's not only, I will just share with you, last 2 days I have for DU, I have 2 lectures for the professors. And I was asking, interacting with them, whether such mental health lectures are there for webinars for them. They said no. I did it for another university and DU took, or HRDC ministry took it from UGC, took that my name from them, and because I did it for another, and I got a very good feedback from the professors, and at this I not did it for students, I did it for professors and college teachers. So you can imagine it's not only the students require that, it's also, even as a mental health professional, I'm telling you, every month, every 15 days I attend one webinar for my own mental health, my burnout, my purpose, my own well-being. I do certain courses, I read it out, and it's very important. I keep interacting with people. I think so in my Last 20 years, I have not interacted so much, how much I interacted with my personal circle in last 1.5 years. I shared my problems with them. Okay, this is the problem I am having. That is the problem I am having. So I will just say the sharing would be become normal. I would say tell the people to speak out the truth, even it is hard, even you don't like. Make in schools, in colleges, if mental health has a subject you can teach, like in especially when you are talking about Srinagar, Jammu and Kashmir, the grief is very major part. Need to, like, people are shifting from one state to another state just for the safety of your own health. And I can correlate because 15 years back, I left my own house. I ran away from my house because of my mental health. Because I thought of that if I will not, if I will be there at my place, maybe I will either commit suicide or either I will die. So I can imagine that the Srinagar where innocent peoples are being killed. So there's a lot of grief. You have your own worked hard, you have your own houses, you have your friends, family, culture. It's okay to normalize to talk about that pain. That pain would be there with you whole time. Like I dealt with the grief counseling cases where people lost their family members. That someone lost their mother, someone lost their father, and you can imagine how much pain they have. Like before you, I was talking with one patient, she was crying in front of me. Even I have a connectivity issues. My Airtel person was sitting, waiting for me to get out from my cabin to just connect the Airtel connection. And I was not able to. I said, child, the person is crying in front of me. I can't tell them, na, mera internet connection theek kar do. And I should be sensitive, not insensitive. Like my Airtel connection is important more than this person's crying. I know this person is not eating food. She's having sleeplessness nights. She's taking alprazolam every night. So I would say, can we talk about normal, about feelings? Like when you are talking, don't gossip. Talk about your feelings, what you feel. It's normal to talk about your feelings. And it's okay to be, not to be okay. You don't like cooking, it's okay. You don't like doing something, it's okay, but accept some things we don't like, but still we do it. No? Out of there is a meaning, there is a purpose. Maybe I also need a break from last 1.5 years, I'm telling you. But I still have a purpose. No, if I will get up, I will do this thing. I can still help lots of people. That's okay. That purpose and meaning should be there. That dream should be there. And each person's dream may be different. Whatever way you can help people, not by money or making or something, but if you're listening to someone, don't mock someone, but just understand, observe people, listen people, and make it a culture that need to observe people, listen to people. Just say they have lots of pain. Not pain have a language of crying. Pain has their own language. It doesn't mean, like the way I said it, this girl not came up and cried on my shoulder that I have never did it. I just observed her. So it's observation, make it normal that you observe people. Just don't do things for the sake of doing it. Live in the moment. Don't think of future also. That's very important, but be empathetic to people. If you don't fix out these issues, just listen to them. You can't do anything for them, just listen to them, just acknowledge them, and make it the part of a culture. If there is 100 employees, 50 employees, make it a compulsion. Every month any mental health professional will visit them. Make it a compulsion that every month mental health webinar would be there. Or I would say all corporates, if can include insurance, mental health, the part of insurance. I think so in the lockdown, in this 1.5 year, lots of insurance companies included mental health in their, I would say, providing them facilitations, because it's very important. And this is like, sometimes people says, I'm not talking negative about my partner. I'm not talking negative about my family. It's okay to talk negative. It's okay. It doesn't mean you are thinking about that person that way. It's just a momentary thought. It's okay to have it. But don't think you are only in pain. Each and other person is in pain. So be more compassionate towards each and every person. I will just say, be compassionate. Maybe the other person is not having problems, but I would say I have to be more optimistic as a professional. But I still says, I remember even today afternoon, I was dealing with one client, and I was telling her husband will improve and give her the time. His wife says, I have no hope. I said, I have a hope. Maybe you are a pessimistic, I am an optimistic. Have hope in me. Last night, one of my clients' partner got late, and she was saying, I know my partner will not come. I said, your husband told me he will visit the clinic. Please have faith. He will visit the clinic today. He will come along with you. So that optimism should be there in one person. But again, it's a two-sided effort always. So some people may not, some people may help you with money. Okay with that, they can help you with money. Some people can help you with your understanding of your emotion. That's okay. So I would say make it a culture part that talking about emotions is normal. And if you can say that break time, they fix it that you can come up and talk about your emotions. Just write down a letter, even to that about problems you are facing. Maybe the boss also understands that. Like I have a busy boss. If some employee or doesn't come and tell me that I have the problem, till the moment I don't observe that person, I may not be able to realize it. So
Definitely. And I guess there are so many things that have just come up. At a more policy making level, definitely we need to take care of everyone, and sometimes we miss it. Like just to mention about how we take care of students but not professors. So we need to take care about everyone, and we need to have those safe spaces where people can actually come up and share about their ideas. And at the same time, we need to be more, I would say, more enthusiastic in terms of uh, developing and changing policy, for example, actually including mental health concerns. Um, I'm sorry, I just forgot the word you just mentioned about part of the insurance, for example. You should
yes,
be we should be able to, and you already have given examples of how certain companies had actually started including mental health in the insurance part, and then definitely having those consultation and webinars for your employees. But at the same time, what you have already touched upon, and this is my next question, is what we can do at the more individual level. Like you just mentioned, we can be more observant, and we should be more listening towards each other. And I personally believe when we are being compassionate and we are listening to others, that actually gives us a room to smile sometimes, because that experience can actually lead you, to just realize something about your own self. It just gives you a good space. So, ma'am, as you also already mentioned about the grief and the suicidal tendency that you see among your patients. So, ma'am, what would be your suggestion for people that they can do at the individual level when they are actually stuck in their homes? That they can, what are the techniques that they can actually adopt at the moment to just manage their grief, their anxieties?
I would say one thing is that imagine good things. That's very important. In imagination, whatever you want, what gives you pleasure, just imagine that thing. That's very important. And just find a meaning and purpose in life. That's also very important. Contribution is not in the form of always money and giving food. Contribution is also making comfort. Listen, even without saying something, you are understanding someone. That is also you are contributing to society. That I like, for example, that you are doing certain things. Sometimes people say, I remember that during this lockdown time, and giving an example, that contribution, somebody called me up and said that I have some problem. I said, I can't be available to you. Can I refer you to my staff? And people said no. So you can imagine that I, as a professional, understand that I don't have time. At least my staff can help you. And the people are very specific. No, no, no. We want you to listen. We don't want any second or third person. So I says that I have a limited time and space or comfortability. Maybe I'm not able to. So start accepting your limitations. That is very important. It's very important. People don't accept their limitations. People have problem in accepting the weaknesses of them. The shame about that, I have a weakness. I have this problem. Like if you go and come up and tell someone you are going through a depressive phase. Oh, so sad. You are going through depressive. Oh, your parents are like this. Oh, your family is like this. Why we say like that? I remember during the this pandemic time, one of my employee told me that he can't have a child. Last 7 years of marriage, he can't produce a child. I said, what's okay? It's okay to not to have a child. There are two things. Either you have a happy couple, you are happy with each other. What's the bother about? Don't think about a child. Second, you can't produce a child. You don't have a sperm count. What's the big deal? Adopt a child if you still want to have a parent. And it's okay not to have a child. Be happy with each other. And I remember I said, you have money, you can go for surrogacy. No, I don't have a money. You have a money for treatment. I don't have a money for treatment. I said, what do you want? My wife wants to have a child of my own and her own, and we are ready to go for a treatment for next 5 years. It's okay. And in that process, how much pressure this guy and the woman is taking, they are not able to understand that. On one thing, it's not happening. They are not giving it up. This is what I'm saying it, that sometimes giving up is very important. You need to accept. You can't do things. Quitters are doesn't mean that you can't quit. Quitter means like, if I'm sorry to say, if I would say river is I will say going, and there is a I will say there is a pathway or a blockage. There is a I will say heavy blockage on the road, or there is some stone, bigger stone is there. What the river will change the way, na? River will change the way. It doesn't know I am a river. I will try to that. Okay, like मतलब वो बोलते हैं ना पत्थरों को मतलब पत्थर दिल रोया नहीं करते, तो वो हिसाब है. Like no, I will cut myself on that stone till the moment this stone will not understand what you are doing. You are spoiling your mental health. You are spoiling your precious years. This person is like, you can imagine, out of 10 things he was forgetting 8 things in a day. Just sitting idle, forgetting 8 things in a day. Sitting idle. I'm in the sessions. This guy is like, after dusting or cleaning, he was sitting idle doing nothing. Just I forgot. Because every time he was thinking about, he was borrowing money for people, because for the loans and everything, putting himself into more pressure, but not accepting what people will say if we don't have a child. Either people say wo banj hai, either people say main na mar du. Can't be comfortable what you are. You can't do anything. It's okay. You can't do anything. But be comfortable into your skin. You are dark color. It's okay. You can't speak English. It's okay. Accept what you can do. But don't speak a lie. Speak truth. Accept yourself. That's more important. Acknowledge what you are feeling. If you are going through anxiety, stressful state, share your concerns. Write down your negative thoughts. Throw out. Without reading, tear it off. As I said it, follow. Sometimes some people give good advices. Go and meet a professional. There is no stigma in that. You are not getting sleep in the night. I remember that during the last 3 months, even 4 months, when I have a work overload, I was getting free late in the night, and sometimes I woke up in the night. I started playing that music, relaxation music, and I got off to sleep. It's very normal. We all are humans. We are not machines. It's normal not to be okay. And I think so that culture should be fine. They will come up. I tell every housewife, it's okay. You don't want to cook. Tell your husband you don't want to cook. I am cooking because you want, or we can't hire a cook. That's why I'm cooking. But if you'll ask me, I don't like cooking. When you do things like this, life will be easy. You don't like studies, but you are doing studies just to get a graduation degree. It's okay. Do what you like to do. Like you want to become a chef, become a chef. Don't become a IIT professor. Don't become a journalist. Don't become a doctor. You don't want to be. Don't follow what your parents says. Take a stand for yourself. It's very important. I would just say maybe the pathway would be difficult, but be there what you want and work hard for that. Don't think your dreams others will fulfill. It is your dreams, and you have to work hard and be concentrated and compassionate towards them. Other can be helpful, but it's your dream, your journey. So you have to do it by your own.
Definitely, ma'am. And just after listening to you, I'm actually feeling really positive. Being very honest, I can feel a surge of energy in myself right now. And I was just trying to just compile everything so that I can just paraphrase it for the audience. But there's so much that you have just mentioned, and I'm just trying to figure it out, like what you mentioned. But definitely, if I just try to figure out certain points, that we can definitely take support of certain majors, like writing down things and listening to music. But at the core, what we all need to do is to normalize is okay not to be okay that you just mentioned, and pain has a language of its own. So just acknowledge and accept your limitations and find meaning in your life. I guess these are the core values that I personally learned today. So thank you so much, ma'am, with these. And since we are just running out of time, we have one question. I'm not going much into the Q&A part right now. I'm just taking one particular question. So ma'am, we have seen that India's health infrastructure was highly burdened with the pandemic, and even today we are still struggling with it. So being a psychiatrist, you have seen how the entire structure was actually in conundrums. So ma'am, what would be your suggestion in terms of the post-pandemic era? What things could be done in terms of improving the health infrastructure at the same time?
I would say lots of people are interested in listening other, be empathetic, be compassionate. Take a professional training for that. That's very important. Without professional training, don't spoil each person's life. I says always that if some person is there, if I will give a wrong advice, if that person go back away and commit suicide, I will not think, like, it will come into my head that what I did it. So I would just say, be sincere towards others. That's it's not only about use. I come up and people says you charge this much of money. Okay, you reach that. I said no one sees that 5 years I've worked for 20, 365 days in a year. 3 hours in a, like you can tell 3 shift I worked. I was just taking $5,000 for 5 years. I was charging for 100 rupees for my counseling sessions. So this is because I have too much. People were keep sharing. I said, I can't take more. Like last night, you can imagine the patients left from my clinic at 12 o'clock. So I am also human. So just see, this is what I say is that you need to listen, acknowledge, accept, don't judge. That judgmental aspect, because I am telling you, when the clients come to me, they say we have went to 20 professionals, 30 professionals all over daily. We know the counselors, doctors, and I'm telling you, then they say is that we find they are judgmental. They are judgmental. I would say I'm mostly criticized by the people for my money making or my charges, my consultation charges are high. So I tell them that these charges are high because I can't able to take their pain. I'm a human. So I have also a capacity of mind, how much I can take. Still I'm busy. Still I have lesser time for my own needs. Still I can't take holiday. If I find a day, I will like to sleep. I will like to enjoy my day. So I'll just say that please take it in this way serious. I remember one of my mental health professional colleague told me, counseling se bhi kabhi patient theek hote hain. I'm telling you, this is the response of a counseling professional in the field of last 18 years in that profession. He's my colleague. He told me, counseling se kuch nahi hota. And I am telling you, I am the product of counseling. I left my practice for 6 months, and after 4 sessions, I started my clinic again. What's a big deal? And I teach people. It's nothing wrong in taking the consultations. Even at that time, I don't took the help of a trained mental health professional, but a general mental health professional like the NGO people still helped me and guided me, because I was aware about if I'll start thinking about my life, I will put my partner out of my life. I know I never want to get married. I got married just for the sake of saving his life. It's just a concept was there in my head. And just is giving an example that I understood, I realized my own mental health. I tell everyone, as a mental health professional, you need to take care of your mental health. You need to set off boundaries. If you are working from home, whatever you are doing, they are doing good jobs. And whatever they are doing, best of their capacities. If somebody comes up and talk to me, this doctor was not doing, I said, every person did the best of their. And I'm telling you, my colleagues told me negative things about me on my face. It doesn't matter to me. They don't know me as a person. They don't know me, what I am doing, what I am doing. So this is, I'll say, it's just if you stop doing judgmental, take proper training for that. And I'm telling you, those people come up and say sorry to me later years back. So it's easy to judge. Don't judge people. That's the very simple. If you want to become a mental health professional, stop being judgmental, because when you start being judgmental, I'm telling you, put everyone under the disorder category.
Definitely, ma'am. And definitely it's important.
We as a mental professional don't want to put people on stigma. Whatever the problems you have, each person have. I may have flaws, you may have flaws, each person understands. And we itself is a complete personalities. Don't focus on your flaws, focus on your positivities. So mental health professionals, do proper training. That's very important. Don't only work on the stigmatization of the disorders, make them comfort that whatever way you are awesome. It says like in Japanese, there is like the broken, they say like they fix them with the golden thing and the
Yeah.
broken pieces.
Yeah.
I always says broken pencils also, they do the same coloring. So each person is perfect in its own imperfections. Accept the person as it is. Stop criticizing others. Just start accepting others and appreciative. The more you give appreciation, more you get it. That's all. I will just say, even in the mental health professionals also, I say is that appreciate each other. That's more
Definitely, I
important.
guess it's really important, specifically this particular phase, when people are just so much stuck and struggling with so many things at the same time, professional life, personal life. And as a professional, and I could definitely say that I could feel your passion the way you are talking and discussing the entire topic. But at the same time, we have come to the very end of the session because it's already 59, so we have to abide by the time. And with this, I would like to thank ma'am, and I would pass on the mantle to Sohini B for a vote of thanks. Uh, yeah.
Thank you so much, ma'am, Dr. Nisha. That was a truly spirited discussion where we could tell that you put your heart and soul to your work. And indeed, we hope you get enough rest and time for your self-care, because we know how you came running to attend to this meeting right after your meeting or session with someone else. So it must have been quite a lot for you. So we are truly grateful, and thank you for the work that you do, for the knowledge that you shared, and for all your services. You do deserve as much as you are paid for your consultation. That is without a
Now
doubt.
we provide free consultation also. That's also there. My interns provide free consultation 12 to 5, Monday to Friday. Even anyone need help, I can repeat the number also, 011 460 11474. If any person is interested, I will say you can put it on your comments also.
Okay.
011 460 11447 number is there. 12 to 5, Monday to Friday, we provide free consultations also. If someone is interested, they can call up.
That is wonderful, Dr. Nisha. This is a truly important information. We will be sure to mention it and add it to our details. And having said that, thank you so much once again for being here. We hope you are feeling all right after such a long session, and you get good amount of rest and can enjoy your days, a few days at least. You truly deserve it. So thank you so much once again.
Thank you.
And with that, we end the session for today. Thank you.
Thank you. Thank you. Thank you. Thank you. Bye.